focus is CPE as building spiritual care competence that I want to just look at briefly, very briefly, in the course of this talk. And the first topic is looking at the term spiritual care and professional practice. The second topic is exploring the concepts of competency and competence. The third topic is viewing of Hubert Dreyfus, who has 7 stages of competency acquisition through a spiritual care lens. He didn't write specifically for spiritual care practitioners, but it's a very compatible theory to apply to spiritual care practice. And the last topic is highlighting 7 ways that I see CPE building competence in spiritual care practice. So to start with, spiritual care, it's a concept and a term that we use all of the time. It's what fuels our profession and our vocation. So to begin with, in its most broad sense, spiritual care is an attitude toward the world. It comes out of who we are as human beings. It's a human capacity we all have. And so it's something we share with one another. Families share spiritual care. Parents with children, children with parents, teachers with students, friends, we all share spiritual care as an attitude toward the world. It cultivates or nurtures a felt sense of connection among us as human people. Spiritual care is also a profession. And I'm aware that that word profession raises discomfort oftentimes in people that are spiritual care practitioners, because we would rather use the word vocation. Vocation is more familiar to us. It's a word that we can resonate with because it's a sense of calling that we have to do what we do in spiritual care practice. But I'd like to suggest that we start to think of spiritual care as both a vocation, a calling, and a profession. As a vocation, it's about us. It's our sense of calling. It's our sense of God or the divine leading us in a particular direction. And for many of us, clinical pastoral education. But it's also a profession. And that's about the people we serve. Professions well crafted will be able to nurture and care for the people that we offer spiritual care to. So I'm proposing that spiritual care be viewed as both a vocation and a profession. And the second term is professional practice. So if we look at different types of relationships that we have with other people, there are social relationships that are mutual and shared. Everybody makes an effort to make the relationship work, whether it's in a faith community setting, in a CPE group, in a situation of shared grief, where people are trying to deal with crisis. There's a sense of everybody trying to participate in a meaningful way. That's one type of relationship. There are another type of relationship is a professional relationship. And in a professional relationship, unlike a social relationship, there is power imbalance. So one person is helping and another person is receiving help. There's a power imbalance in that relationship of helper and helpee. In a professional relationship as well, there are role differences. So we can speak of a chaplain and a patient, a pastor and a parishioner. These role differences are related to the power imbalance. So in a professional relationship, there are components that make up what a profession is. And all the professions, from nursing to health, to doctors, to other allied health professions, to professions outside of healthcare, there are these 5 components of a profession. The first is that it involves a special kind of knowledge and skill. So in spiritual care, we gain our knowledge from theology, psychology, sociology, philosophy. So it's a knowledge base that we build on. And we build our skills from clinical pastoral education skills or field education skills. So a special kind of knowledge. There's a sense of accountability to a standards of practice. Standards of practice are really about doing the best for those that we care for. So we want to be the best spiritual care practitioner, the best CPE supervisor, not competing with one another, but being the best for those we serve. We want to give them our very best. And that's where standards come from. Standards become the best that we can offer, and they get written down as standards of practice in different spiritual care associations. But they have to do with trying to offer those we serve the best care we possibly can offer. So it's a type of accountability and a place where we can say, am I doing as well as I need to be doing in offering spiritual care? So standards of practice. Thirdly, a code of ethics. Codes of ethics support professional practice, and they involve how we treat other people, how we treat our colleagues. They look at confidentiality, they look at proper boundaries, they look at other aspects of ethical behavior that are very important for us when we think of ourselves as professions, and a profession is about caring for those we serve. So codes of ethics are an important part of a profession. A fourth part is peer regulation. Nobody understands spiritual care like spiritual care providers. So as peers, we try to regulate and make it as good as we can possibly make spiritual care in whatever our context, whether it's healthcare, prisons, the military, wherever we provide spiritual care. So we want it to be regulated. We want it to be notable and good quality, best quality. And lastly, every profession involves continuing education and professional development. So we always need to be like lifelong learners in spiritual care. And then in professional development, oftentimes people take one unit of CPE, but I think most of our professional associations ask for several units of CPE so that we can go on and become certified as spiritual care practitioners and spiritual care supervisors. So professional development means moving forward, taking more CPE than less, learning, if I'm really good at palliative care, maybe I need to learn a little bit about surgical chaplaincy or another type of chaplaincy. So it's continual education and professional development. Those are the components of a profession. Going to that second topic of the 4, the 2 concepts of competency and competence. In spiritual care associations, especially in the United States and in North America, but really globally, and many people from East Asia and New Zealand and Australia and other parts of your world, competency-based learning is developing. So there's a greater emphasis on competence, and competencies have been listed, and these lists of competencies have been circulated broadly around the world and within different professional spiritual care CPE associations. So competency-based learning, important as distinctly content-based learning or only context-based learning. So it's about learning competencies. That's why I want to give emphasis to CPE as developing competence in spiritual care in this talk. A second aspect that's been developing a lot in the last probably 10 to 15 years, especially in the United States, they've really done a lot of development here, is evidence-based practice. And a lot of this is done by way of research. So there's a whole healthcare chaplaincy, a big, huge organization that promotes research. And there's a transforming chaplaincy website that you can go to and learn about research. There are courses in research. And a lot of this is realizing the vision of a person whose name is pretty well known around the world because he's really dedicated his life to furthering the profession of spiritual care. And that's Reverend Dr. George Fitchett. So George Fitchett founded the Transforming Chaplaincy initiative, and he's been very active in a lot of the research that's there. So I just commend him and am very grateful to him for the ways that he's touched my life, even though he doesn't know it. He's just a wonderful person. So you can look up on the internet, Google George Fitchett, Google Transforming Chaplaincy, Google evidence-based practice in spiritual care. Very important to the development of competency and competence. So now I'm going to look at competency and competence as concepts. Sorry. The lower right hand is what we're looking at. If we summarize, competency is something we do. Competence is how well we do it. So think of listening as a basic competency for spiritual care. We learn how to listen long before we come to CPE. But in CPE, we try to learn to listen in new ways so that the focus of our attention is on those we serve. What are we hearing? How are we communicating with the people we're listening to? And our listening skills develop over the course of a CPE unit and certainly over the course of more than one CPE unit. So how well we listen increases over time. So when it comes to a competency, there are 6 dimensions. It's not just about listening. It's about bringing who we are as listeners. So a competency starts in the person. There are 6 dimensions to competency. The first is motives. Why do we do what we do? What's driving our actions? What's motivating us? Maybe I want to be the best chaplain there is, and I want to look like the best chaplain. So what's motivating me is, when I bring my verbatim to clinical pastoral education, is I want to show the supervisor and my peers that I'm the best chaplain ever. And so I'm bringing a success story. Okay, but was I the best chaplain for the patient? Was I the best chaplain for the military man or woman? Okay, so what drives us can be self-oriented or it can be other-oriented. It can be both and. Why do we do what we do? So listening to our motives is very important, and it's a dimension of a competency. A second dimension is traits, patterns or habits of behavior. We all have traits or habits of behavior, and we can count on those as spiritual care providers, but also as the people we are. So Dobong and I know each other well enough that I know I can count on Dobong to act in certain ways, and that in his doing that, I'm going to feel his respect, his kindness, and his care. And I think he also knows me well enough from the traits that I bring to our relationship that he can count on certain ways that I'm going to behave. So traits are a very important part of a competency. A third dimension of competency is self-concept. Now we're going to talk about self-concept in two ways. This is the first way, and it has to do with the picture we have of ourselves, our self-image, our self-worth, our self-esteem. How well do we like ourselves? How well do we like ourselves? So it's the picture we have of ourselves. That's self-concept, a first approach to self-concept. A second approach to self-concept has to do with the identity we've derived from our worldview. Each of us has grown up in a different part of this planet. We've grown up in different cultures, in different countries. We have different languages. We have a lot of those qualities to our self-concept that come from our worldview. When we stand up in this world, when I stand up in this world in Canada, I see certain things. I can look up at the sky and see certain types of stars. If somebody stands up in this world in another part of the world, say in the Southern Hemisphere, they're going to see different stars. They're not going to see my stars, and I'm not going to see theirs, all right? Because we're in different parts of the world. And that's true geographically, and it's true culturally, attitudinally. So our self-concept not only is our self-image and our self-worth and our self-esteem, but it's also the identity that we have as a Korean man or woman, as an Australian man or woman, as a Canadian man or woman, as an American, a US man or woman. It's all of these diversities that are there. Self-concept, really important to see that as a dimension of competency. Fifth is the knowledge that we bring. So we have our, as spiritual care providers, we have academic knowledge that we get through our academic degrees, and we have clinical knowledge that we learn through, especially clinical pastoral education, field education as well, teaches clinical knowledge. And there are other ways that clinical knowledge is learned, as well as academic knowledge. And lastly, there are skills, abilities to complete tasks. We have to bring all of the previous 4 dimensions of a competence to the skills. We need to bring our motives, our traits, our self-concept as self-image, our self-concept as identity derived from worldview, our knowledge gained in academics and in clinical to the skills, so that the listening skill or the spiritual care intervention skill comes out of all of who we are. That's bringing a competency. That's how we live a competency. The second concept is competence. So competence is how we do what we do. And I'm just going to highlight 2 types of competence. There's competence at a level of threshold, where we are coming into doing spiritual care as beginners. So it's beginning work, threshold competence. A second type of competence would be differentiating competence. And this is where we function, as spiritual care providers, with more complex and advanced work. So threshold competence is beginning competence, at differentiating competence is more complex competence. So as a listener, I may be able to hear somebody and not move away from what they're talking about when they're saying something that's uncomfortable, perhaps to us, perhaps to them. Sometimes we like to turn the conversation in a more comfortable direction. And we learn that we do that by writing the verbatims right. And we catch ourselves going in the direction of avoiding what the person's really saying. So learning how to stay with a patient or a prisoner or a parishioner is very important, threshold competence. But then as we learn to listen more carefully and in a more complex way, we start to listen to ourselves and to the other at the same time. So we listen to how we're feeling. Am I comfortable? Am I uncomfortable? Is that person comfortable? Are they uncomfortable? Are they grieving? Are they triggering something in me? Can I be with them? Can I really be with them as other than me? Can I be outside of myself? So we start to differentiate. And then we start to hear that they are coming from a particular story. We start to hear their faith story. We start to hear their family story. We may start to hear their work story. All of these different differentiations start to emerge in the spiritual care relationship. So it gets more complex and it's more advanced work. So competence can be at the threshold level and at the differentiating level. So competency is what we do. Competence is how well we do it. The third topic has to do with Dreyfus's 7 stages. And I'm going to talk about them through a spiritual care lens. Although Dreyfus did not write to spiritual care providers, but his insights emerged in the 1980s. And originally he had 5 stages of competence. And his 5 stages of competence have been used by a number of professions. Doctors, nurses, other allied health professionals have used the Dreyfus stages of competence. In 2001, Hubert Dreyfus went back into the 7 stages with another question. And his further question was, can people learn competence online? Or do we need to learn it by being in person? And in his document, which you can find very easily by Googling, on the internet is the title of the document, and it's by Hubert Dreyfus. And in that document, he has developed the 7 stages of competency acquisition or skills acquisition. And that's what I want to go over very, very briefly here this afternoon using a spiritual care lens. So the first stage, and all of these stages build on one another. You cannot go to stage 7. You have to start with stage 1, right? And they build because according to Dreyfus, there's instruction, there's practice, and there's apprenticeship. And I'll talk about that again in a few minutes. But the earlier stages of skills acquisition inform the later stages. So the first stage is being a novice, new. And we learn a lot by instruction, by rules, by the do's and the don'ts. And those of you that are CPE students know that you do a lot more instruction to students as they get oriented to the CPE program and to the clinical location where they're going to be. There's a lot more information to have to communicate to students, a lot more instruction, what they do, what they don't do. And it's not just rules in a negative sense, but it's rules as providing a framework out of which CPE students can build their competence. So it's setting the groundwork for spiritual care. The second level is advanced beginner. And these are people who are working, they've acquired some of the basic skills, they've internalized and listened to and gained expertise in the instructions and rules, the do's and the don'ts. And now they're learning by maxims and by options. They see that there's more than one way to do things. There's several ways to do things. So a maxim that I learned when I was working in acute care hospitals was in terms of who do you respond to? Who do you go to first? So one of the maxims that we had at the hospital where I worked was you try to respond to an on-call call first. That has the highest priority. So if the pager goes off, you respond immediately. If you get a referral, try to respond within the day or within the time that you're there as quickly as possible, but not necessarily immediately. And then if you want to do self-initiated visits, then do them like they'd be the third priority. So that would be a maxim, on-call first, referral second, and self-initiated visits first. That would be kind of a way of exercising options. Other people use other options. Looking at sometimes, a lot of times, chaplains will be part of conferences with all the health professions in the hospital, and they will listen to where they think the most important need is, and they'll respond there. So options exist, and advanced beginners start to pick up the maxims and the options. The third stage is competent learner. And these are people that can listen inside, listen outside. They're discerning the best option. So they see the options that are there, but now they're trying to do the best thing for the patient or parishioner or prisoner. What's the best good for that person? And that means that they've assessed very carefully. They've looked at some possibilities. They have a sense of what the person really wants to do, and they try to respond as best they can. So competent learners can sometimes get overwhelmed with all of the options that are there, and can get discouraged with so many options, and think, well, I know more than I've known before, but I feel like I'm not doing my best. So it's important to encourage, as a CPE supervisor, these are the times to encourage our students and to affirm the competence that has been acquired. A fourth stage is proficient learner. And here's where we start to see the embodiment that's part of spiritual care, where people start to say, I really love the people I'm serving. I really care about these people. I'm really hooked. I have a passion for the people I am serving. And proficient learners begin to embody this. They take initiative, they take leadership. They're very committed to those they serve. And proficient learners then bring all of the rules, all of the instruction they've gained, the maxims, the options, the inner outer discernment, the discerning the best options. They embody it. It's in who they are. And this is where supervisors start to see differences in students. You start to see how this particular student is embodying his spiritual care practice in a different way than this student is embodying her spiritual care practice, or another student. And it's because it's becoming more and more in them. It's becoming more and more them. Stage number 5 is the expert. And this is where we personalize our approach. By the time somebody is an expert, they should be certified, right? So the previous, I'm going to go back here, probably the novice and the advanced beginner, and I'll point this out in a minute, are more at the level 1 CPE or basic CPE level, foundational CPE. So they're entry level CPE practitioners. By the time people are competent learners and proficient learners, they're probably at the advanced level or level 2. And then by the time they get to expert, that's when you want to see people certified or having completed their CPE and working in spiritual care as practitioners. Then the personalizing becomes more and more, it's almost like in the Christian theological sense, we're incarnating our skills. We're incarnating the models that we've learned from. We're incarnating the crises that we've faced, the learning that we faced, the people that we're serving, what they faced. So we're learning to be who we are in a variety of contexts. And oftentimes when people complete CPE and move into certification, they have excellence in a particular type of spiritual care. So somebody might have done clinical pastoral education as street ministry. So somebody coming to the expert stage is an expert street ministry spiritual care provider. Or somebody might be a hospital chaplain. they become an excellent spiritual care provider in a hospital, but they may know nothing about military chaplaincy. I would know nothing about military chaplaincy or chaplaincy in a prison, right? So I may be expert in a particular area, but not in all areas. And that's why we have to keep into lifelong learning. The sixth stage is master. And this is where we develop a personal style. And whether we then are in an area where we're expert or whether we move into another area, we bring who we are to what we do. We have our style, we have our comfort level, we have our slow motion or anxious motion or particular skills or particular approaches. We bring all of that. So if I go from, in my particular case, I went from parish-based clinical pastoral education into hospital-based spiritual care and clinical pastoral education. I learned a lot in a parish. I only did one unit there, but I learned a lot, and I brought some of that with me to the hospital, where I learned a lot more. And I feel I developed my expertise there and my mastery in hospital-based spiritual care. But I would love to learn more about a different type. Like I know a colleague who is expert in care for the elderly and people living with dementia. And she brings tremendous skill in that area, skill I don't have. And so I can learn from her as I watch her and I kind of apprentice with her. That's the word I'm looking for, apprentice. So personal style. And then practical wisdom is the seventh stage. And this is where Dreyfus talks about cultural style. And Dobong and I worked a lot over the last several months, reflecting a great deal on this stage of skills acquisition by Dreyfus in terms of cultural style. What Dreyfus says is that we don't know, well, practical wisdom to start with, that phrase comes from the philosopher Socrates, who says that practical wisdom is to do the appropriate thing at the appropriate time in the appropriate way. So it's to bring to whatever we do the optimal manifestation of what spiritual care can be. But he says we don't know that there's the issue of a cultural style until we bump into differences in our cultures. Then we learn about practical wisdom as cultural style. Okay, so it's learning to communicate when we don't share the same language. I'm aware I'm speaking in English, and I'm aware that, and that's my first language, but I'm aware that not everybody who's listening has English as a first language. I would not understand somebody speaking, offering this talk in Korean, because I would be unfamiliar with that language. So we have a cultural difference there. And that's where we have to struggle to meet each other respectfully across our differences. And so Dreyfus talks a fair bit about practical wisdom as cultural style and the discipline it takes to bring one's culture into an unfamiliar situation and try to be who we are in that unfamiliar, often uncomfortable situation. So Dreyfus is an excellent theory that can undergird, I think, the rating of competency development. There are, in many spiritual care associations, there are scales that are developing to say, okay, a person is at this level or this level or this level. And I think Dreyfus offers an excellent foundation, theoretical foundation. We're going to necessarily take on Dreyfus entirely, but find our own language in our different languages that capture the essence of what Dreyfus has to offer for showing how spiritual care practice develops from initial level, novice level, threshold level competence to expert mastery levels of competence. So if we take his stages, I would say that stages 1 and 2 feature instruction in learning a competency. Stages 3 and 4 feature practice in learning a competency. And stages 5, 6, and 7 feature apprenticeship. By the time we get to stages 5, 6, and 7, expert, mastery, and practical wisdom, we're not carrying around a book and taking notes anymore. We're walking side by side with other people. We're observing people. We're experiencing that change to who we are and that embodiment at a very, very deep level. So the fourth and the final topic I want to look at is the ways that I see CPE building competence for the great change era that we are living in, and ways that I think CPE, as it flourishes around the world, and as we collaborate around the world among our different cultures, that we can be an energy of hope for building competence and for the 21st century. So I have 7 ways that I'm going to list here. And the first is that CPE is an adult learning process. And in Canada, I don't know if this is universal in all spiritual care associations or in all supervision learning, but in Canada, we have to take a course in adult learning in order to become supervisors. So we take an adult education course, and it's a requirement to become a supervisor. And knowing how to teach adults is really important. So even when we talk about instruction and rules, it's within the context of adult learning. We don't need to follow students around a lot. They're going to be independent learners, and we just need to nurture their strengths and invite them to reflect on their limitations. CPE views spiritual care as both an attitude toward the world and a profession. So spiritual care is both and. It's both an attitude toward the world that we share with other people in our families, among our friends. We receive spiritual care and we give spiritual care. And it's a profession in all of the ways I described before, because it's a type of power imbalance that we need to be responsible for as the ones who are offering a service. Third, CPE fosters relational and embodied learning. In CPE, there are a number of relational learning environments. There are relationships between students and the people they serve. That's a relational learning environment where students learn from the patients or the prisoners or the military or the parishioners. They learn and they also bring their gifts. So it's a relational learning environment. Another relational learning environment is the CPE peer group. There's a relationship among the peer group with the supervisor and the students where there's relational shared reflection and relational learning. And there's a relational learning environment between supervisors and students. So those relationships are essential to CPE learning. And there are more, I'm sure, that we can speak about, but this is a very brief look. Fourth, CPE seeks integration of lived experience, shared reflection, and apprenticeship. So it's not, we don't want to accumulate information, incarnate what we know. We want to make it, we want to embody it. And so lived experience is very important. Practice is very important. Spiritual care practice. And it's not practicing on other people as we would practice how to apply a mathematical formula, right? It's more relational practice. It's learning within relationships and accumulating lived experience as spiritual care practitioners, sharing reflection, those verbatims, those critical incidents, those case studies are the gold of clinical pastoral education, where we learn how we succeeded, how we made mistakes, how we could learn more and improve ourselves. And then apprenticeship, where we are learning by watching. We are learning by doing. We are learning in an embodied way. Watching our supervisors. I remember when I first was certified at the entry level of a supervisor, I went to a new location and I came in as a director of spiritual care, and I was the CPE supervisor, and I was developing a CPE program. And I kept noticing that I kept doing everything my CPE supervisor. I had developed habits of behaving like my CPE supervisor behaved, and I didn't even realize it. Turns of phrase that he used, mannerisms that he had, and it was just because I had apprenticed with him, and my apprenticeship I embodied, and I really liked him and respected him. So I brought that into who I was. And then when I realized that I was kind of being a bit of a copycat, I had to rethink, well, how am I different? Is that really what I want to do? So I matured a bit in my supervision as I kept supervising and learning by experiential learning. But that apprenticeship is really important. And I worked with other supervisors. Wherever I've been, I've benefited greatly from working with other supervisors and collaborating with supervisors like Dobong, and I collaborated when he was here in Canada. 5, CPE threshold and differentiating degrees of competence. And I don't think I need to say more about that here because we've talked about that before. But knowing that we don't start from the top, we start at the beginning and we build to greater and greater expertise. 6, CPE serves as a learning foundation for certification and continuing education. And CPE is where we start in professional spiritual care practitioners. It's what informs us. It's where we integrate our head knowledge and our heart knowledge and our skills knowledge. And it should lead us to certification. Spiritual care is, if we want it to be a profession that's respected by other professions, then we need to make the gold standard certification. A registered nurse could not provide nursing if he or she was not registered. Right? Other doctors, the same, other health care professions, we need to become certified, and that needs to be our gold standard. And then lastly, I believe that CPE contributes to excellence in spiritual care for the 21st century. We're living in a very strange time. I suppose across the centuries, people have had that same feeling over the years. But I want to just close off these comments by reading the end of the talk. I'll find it here in a second. And I want to read it because I think it speaks to, here we are. I'm going to put it up and share it. So what I want to do is just read the conclusion to my talk, because I think it speaks from my heart to how this comes alive for me, how CPE is cultivating competence in spiritual care practice. And I have to start that in humility and honesty. I know that my cultural and experiential knowledge is very limited. I'm grounded in North American CPE, both in Canada and the United States. I'm aware that I don't know or understand the experience of those who supervise and participate in CPE programs located in the CPE or the ANZA CPE and other geographically proximate CPE associations. So I speak with that poverty of my own limitation and my own humility as I meet you in this very limited way. But that said, I hope that my few comments here this afternoon will contribute to our ongoing sharing and learning together. In this learning and sharing, there is hope through CPE in the great change era of this 21st century in which we live. And in particular, I hold two specific hopes about CPE. And my first hope is that CPE associations around the world will come together more intentionally and collaboratively to recognize and reciprocate with one another in the areas of intercultural CPE program development and certification equivalencies. This has potential for international reflection on competency-based learning and the assessment of competencies as spiritual care professionals. And I could speak to Dobong's and my relationship in terms of some of the barriers that he faced and he and I together faced when he, as a man with training from the Philippines, came to Canada, and his training was not reciprocated in Canada. And I think we need to wrestle with what prevented those of us in Canada from fully respecting and recognizing the depth of knowledge that Dobong brought from his training in the Philippines and then brought on to Korea. And there are many stories like that, I think, in our lived experience of CPE. So that's one hope I have, is that we can talk more across our different associations and find basic competencies. And building on that, then my second hope is that CPE supervisors and learners from various parts of the globe will take up and further explore a question that Dobong and I have reflected on over the past months as part of a writing project we've been part of. This question that we've worked on comes from Dreyfus's Stage 7 on practical wisdom. And it arose when we both thought about our shared passion for CPE and CPE supervision. And we worked with the question, which CPE learning elements are considered essential across cultures and which are culturally flexible? This question has had me thinking now for a long time, and Dobong and I had some wonderful conversations about this. And I hope that this question that we've been working with can be shared more broadly with other people, other CPE supervisors, CPE students around the globe, so that we can develop a collaboration of CPE for our world and enhance, build, strengthen, make excellent, make meaningful spiritual care practice in all of our cultures, with all of our people. So for now, I wonder and I hope, is it possible to become a place where cultural differences are recognized and respected, where we can meet and engage with one another as other in such a way that we come to understand how meaning is constructed differently in another culture, and learn to read the meaning rather than being distracted by the practices we're observing that are different from our own, and where some of the polarization and conflict of our current age can bridge through competent spiritual care. What if we could bridge some of the polarization and conflict by being spiritual care providers as people who carry an attitude of spiritual care within the world, and as professionals providing spiritual care in a variety of settings? So in this hope, there may be healing for our world, but as yet we're not there. So I want to take that passage from the Romans where it says, if we already have what we hope for, there's no need to keep on hoping. We don't have it yet, but let's keep on hoping. Thank you again, Dobong, for letting me be part of this conference.